This recorded review will be going over the Exam 1 study guide for Med-Surg 1 in the Med-Surg textbook over chapters 1 through 6. Chapter 1, Caring for Medical Surgical Patients. What is the purpose of a state's Nurse Practice Act? Many Nurse Practice Acts specifically state that the LPN charge nurse So we're actually going to find that answer on page 4. Each state's NPA defines the role and scope of practice of the LPN. Page 4. What are the 5 rights of delegation? We can find those on page 3. The 5 rights to delegation are the right task, the right circumstances, the right person, the right direction and communication, the right supervision and evaluation. The LPN reinforces education. What information should the LPN help reinforce prior to discharge with a patient? We can find that information on page 2. Some teaching activities would concern how to take prescribed medication, what side effects to report, and the self-care activities and lifestyle changes required to promote rehabilitation and independence. Some examples of teaching include reinforcing what the RN or provider advises regarding scheduled diagnostic tests, upcoming surgery, how to treat a wound, or how to change a dressing, while also addressing the patient's questions and concerns. You can contribute to the discharge plan by reinforcing discharge instructions and providing information to patients about community resources and self-help groups. And that's on page 2. Under which insurance provider coverage can services be very limited? These patients should be informed of this so that they can call ahead and ask about coverage. So this will be a managed care system. So we can find this information on page 9. Managed care is a type of group health care insurance developed to provide quality health care with cost and care use controls. This is accomplished by paying providers to care for groups of patients for a set capitation fee and by limiting services. Medical necessity and the appropriateness of the healthcare services are monitored by a use review system. Types of managed care systems would include a healthcare maintenance organization, or HMO, and preferred provider organizations, or PPOs. This option is used by Medicare and private insurance companies. What is a deductible? We can find that on page 7. A deductible is the yearly amount an insured person must spend out of pocket for healthcare services before the insurance provider will begin to pay for all of the services. What does Medicare Part A cover? We can see that in box 1.3 on page 8. Some basic components of Medicare. Take a look at Medicare Part A. It helps pay for inpatient hospital care, including drugs, supplies, laboratory tests, radiology, and the intensive care unit. What is the focus of the therapeutic nurse-patient relationship? How should the nurse respond to patients when they're acting in ways that are confusing or uncomfortable? We can see that the focus of the nurse-patient relationship is on the patient's problems and needs. That's on page 9. For how to deal with a patient when acting in ways that are confusing or uncomfortable, look at page 10. They may act in ways that are confusing and uncomfortable for a nurse who is not prepared to act therapeutically. It's important not to take statements or behaviors personally, but to objectively consider why the patient might be responding in that manner. Appropriate nursing responses will require kindness, understanding, and sometimes firmness. How should the nurse respond to a patient who asks for an additional dose of pain medication? However, their next dose is not due for several hours. We can see the answer to that on page 11. Assess the need for further pain medication before the next dose is due and determine whether the medication is effective. If the pain medicine is not doing its job, approach the healthcare provider and ask for an order change. Remember your therapeutic communication techniques. You can find them on your fundamentals within your fundamentals textbook on page 108. How would the nurse respond to a patient who felt her illness was a result of punishment from God? What is an empathetic response? We can see a little bit more information about this on page 12. Crisis informations often surface in acute healthcare situations. Patients' beliefs and values can profoundly affect their response to these crises and their attitude towards their treatment, as well as their rate of recovery. The need for spiritual care for patients and families may be intensified by hospitalization, pain experiences, chronic or incurable disease, terminal illness, or the death of a loved one. And remember that active listening is sometimes one of the best techniques to use in these situations. Explain fee-for-service insurance coverage. We can find that answer on page 7. The traditional method of financing healthcare services is called the fee-for-service method. This involves direct reimbursement by an insurance company to a provider. This is a licensed healthcare professional, such as a healthcare provider, dentist, or nurse practitioner, whose healthcare services are covered by the health insurance plan. Chapter 2. Critical thinking, clinical judgment, and the nursing process. What are some characteristics of the critical thinker? We can see that on page 16 in box 2.1, characteristics of the critical thinker. It's important to maintain an open mind and a questioning attitude. Be able to differentiate between subjective and objective data. If you need a refresher, you can find the definitions of those on page 18. Subjective data is data that the patient gives that cannot be seen or felt by another person, such as pain. And objective data is data that can be verified by sight, smell, touch, or sound. Who is always considered the primary source of information? We can see this on page 19. The patient is the primary source of current information and knows more about the problem than anyone else. Nurses use all their senses when interviewing and assessing patients. How does the sense of olfaction help with interviewing and assessing patients? We can see this on page 21. Olfaction, or the act of smelling, can provide data about a patient's personal hygiene, as well as clues to possible illness. A sweet, fruity odor of acetone can be indicative of diabetic acidosis. Remember things to include when documenting and be able to differentiate between great and poor documentation of assessment findings. For example, how would you document significant edema? We can find a really great example of documentation So for things to include when documenting, just remember that we want to be as factual as possible. You only want to document what you can see and measure, directly what you would smell. If you're documenting what the patient says, remember to use exact words and quotation marks whenever possible. In documenting significant edema, you would document where this edema is. If it was pitting, you would document that it pitted, as well as how long it took for the skin to return to its normal state after you pressed on it. You would also document whether or not it was bilateral, whether the patient was experiencing any pain, any redness, any swelling, or not any swelling, but any leakage from the edema. What is the technique for assessing skin turgor? We can see that on page 22 within the purple focused assessment box. Assess the skin turgor or elasticity by gently lifting the skin on the upper chest with your thumb and forefinger, and then observing the speed of which it snaps back when you let go. Remember that HIPAA law, as well as how it relates to our clinical. Is it okay for students to make copies of protected patient documents? No, it is not. Do we use names or ages in post-conference? No, we do not. When evaluating actual patient performance compared to goal outcomes, the nurse notices the data is showing a lack of progress. What should the nurse do next? You can find the information for that on page 27. If the data shows a lack of progress towards meeting the expected outcomes with planned interventions, the intervention should be reviewed and revised. How should the nurse proceed if during the initial interview with a patient, they suddenly clutch their abdomen and grimace? You can find the answer to that on page 20. Use your eyes to pick up clues about the patient's physical and mental condition. Note the patient's facial expression, posture, grimaces, and movements, and whether their answers are congruent, which means that they match the feeling or tone of what they verbally said. If the nurse observed a patient guarding or the patient holding onto an area of their body, the first thing they should do is ask if they are in pain. The nurse is interviewing a patient. Ask the patient to state their complaint, and they say, "It all started this morning with a red sky." How should the nurse proceed? For that, we can look on page 21 in box 2.5 with some interview suggestions. Ask for clarification if you are unsure what the patient means by a particular statement or response. What needs to be included in a complete NANDA diagnosis? We can find this on page 24. A complete NANDA nursing diagnosis includes the problem, which is the NANDA stem, the etiology, which are the related causes of the problem, and the signs and symptoms, which is the evidence for the problem. Recall prioritization of patients based on their ABCs, airway, breathing, circulation, and be able to use that knowledge when given a set of information regarding a patient and then choosing their priority problem. Chapter 3, Fluids, Electrolytes, Acid-Base Balance, and Intravenous Therapy. Define osmosis. What major substance moves by osmosis in our body? We can see this on page 34. Osmosis is the movement of pure solvent or liquid across a membrane, and water moves by osmosis. Fluid will move between the interstitial and intracellular compartments, between the interstitial and intravascular compartments by osmosis. What hormone controls how much fluid leaves the body via urine and can cause reabsorption of water in the setting of vomiting or diarrhea? That's going to be found on page 32, and that's antidiuretic hormone, or ADH. It is released by the posterior pituitary, and it controls how much fluid leaves the body in our urine and causes reabsorption of water from the kidney tubules. Define diffusion and what moves by this process. We can also see that on page 32. Diffusion is the process by which substances move across the membrane until they are evenly distributed in the available space. When the solution on one side of the membrane is more concentrated than the solution on the other side of the membrane, The particles in the more concentrated solution will travel through the membrane to the less concentrated side in an attempt to equalize the concentration of the two solutions. Diffusion is a spontaneous mixing and moving that allows the exchange of molecules or ions. These are electrically charged particles, cellular nutrients, waste, and other substances dissolved or suspended in body water. Define active transport. Give an example of an active transport system that is vital to survival. We can find that on page 34. In contrast to diffusion, osmosis, and filtration, active transport requires cellular energy. This can move molecules into cells regardless of their electrical charge or the concentrations already present in that cell. Active transport can move substances from an area of lower concentration to an area of higher concentration. The sodium pump is the mechanism by which the sodium and potassium are moved into and out of the cells via active transport. So that's a great example of an active transport system within our body that is definitely vital to survival. The UAP weighs a patient for daily weight and notices they're 2 kilograms heavier than yesterday. How would the nurse interpret this in liters? We can find this on page 35 within the clinical cues box. The most accurate measure of fluid gain or loss for any age group is weight change. A weight gain or loss of 2.2 pounds or 1 kilogram in 24 hours would indicate a weight gain or loss of 1 liter of fluid. So if a patient was 2 kilograms heavier than yesterday, the nurse should interpret that as 1 liter of fluid heavier, or 1 additional liter of fluid within their system. Know the signs and symptoms of hypokalemia related to the GI system. We can see this on page 43 in table 3.4, electrolyte imbalances and nursing interventions. Hypokalemia, which occurs at a rate of potassium in the body that is less than 3.5 milliequivalents per liter, will result in signs and symptoms such as abdominal pain, paralytic ileus, gaseous distension of the intestines. Which electrolyte imbalance is associated with spasm twitches of the lips and face, known as Chvostek's sign? We can also find that on page 43, and that is going to be the imbalance of hypocalcemia, which can be identified with a positive Chvostek's sign or a positive Trousseau's sign. What are important safety considerations regarding the administration of IV potassium? We can find this on page 45 in the red safety alert box. Intravenous potassium. Adequate renal function must be present before IV potassium is administered. Intravenous potassium must always be diluted before administration and is never given as a push, which is a rapid, undiluted injection. Be familiar with foods to avoid when on a low-sodium diet. Well, we can see some of these on page 44 in the red box showing foods high in sodium. Notice that ketchup, cheese, dried fruits, and tomato or vegetable juice are all on that list. Know the signs and symptoms of hyponatremia. So we can find this on page 42 within table 3.4, electrolyte imbalances and nursing interventions. Hyponatremia occurs when sodium in the body is less than 135 milliequivalents per liter. It can result in fatigue, headache, mental confusion, and muscle cramps. Memorize the normal range for all electrolytes in table 3.3 on page 42. Answers on the exam will require you to know these values. That means that they might give you a value rather than just saying hypokalemia. They'll give you a value of 2.8 and expect you to know that that is hypokalemic. As a patient's fever rises, with each degree higher, they are losing what percentage of water? We can find this answer on page 34. Perspiration can account for a fluid loss of up to 2 liters per hour in an adult. For every degree of fever on the Celsius scale, an insensible or unaware of loss of 10% can occur. Chapter 4. Care of preoperative and intraoperative surgical patients. What is the purpose of administering epoetin alpha before surgery? We can see this on page 65. Epoetin alpha, or Epigen or Procrit, can be given before surgery to stimulate red blood cell production, and hemostatic agents can be given before or during surgery to promote clotting. Why is it important to assess for corticosteroid use during the interview with a patient who is scheduled for surgery? We can see this on page 67. It is particularly important to know if a patient is taking a corticosteroid, which can delay wound healing, alter fluid and electrolyte balance, and affect several metabolic functions in the body. These are factors that increase the patient's surgical risk. These patients need to be questioned about their medicines and eye drops that could contain a corticosteroid. This information is extremely important to share with the healthcare team. Why is it important to assess liver function prior to surgery? We can see this on page 66. Actually, we can see this on page 68. It's going to be in the bolded text. Surgery puts a strain on the cardiovascular, renal, and respiratory systems. Liver function is important because the liver is involved in synthesizing clotting factors, producing albumin, and metabolizing and detoxifying drugs. On page 68 in box 4.2, we can see some commonly ordered preoperative tests. The metabolic panel includes liver function tests, such as the AST, ALT, and bilirubin. Elevated liver function tests can put the patient at risk of excessive bleeding during surgery. What is an important safety precaution that the nurse must observe after medicating a preoperative patient with a sedative? We can see that on page 76 in the red safety alert box, preventing falls. If the patient has received a sedative preoperatively, remember to put up the side rails of the bed per the facility protocol and to lower the bed. Place the call light button within reach and remind the patient not to get up without assistance. These are important patient safety measures after administering sedatives. The nurse is preparing a patient for surgery and they refuse to remove their wedding band. How should the nurse proceed? We can find this on page 74. If a wedding band is to be worn to surgery, tape the ring to the finger without restricting circulation and tape a cotton ball over the stone to prevent loss when the tape is removed. Why is excessive fear a surgical risk factor? On page 69 in table 4.2, we can see some surgical risk factors, and at the bottom of that table, we see excessive fear. This stimulates the sympathetic nervous system and will cause the release of hormones, causing swings in the body's chemistry and vital signs. Increased muscle tension will make surgery more difficult, and the physical manifestations of fear can interfere with achieving the desired state of anesthesia. These types of patients will require further instruction in order to be emotionally prepared for their surgery. Before administering preoperative sedative medication, what should the nurse check the chart for? We can see this on page 71. The patient must be mentally competent and give consent freely and without coercion. You must always check that a consent form has been signed before giving any preoperative medication. The patient asks you why the operating room is so cold. How should the nurse respond? What temperature should the OR be? We can find this information on page 77. The temperature in the OR is kept at 66 to 70 degrees. This is to discourage microbial growth and to keep the surgical team comfortable while they're under the bright lights and in many layers of surgical clothing. Understand procedural anesthesia and what is included in this. We can find more information about this on page 79 within table 4.3, types of anesthesia. Take a look at the procedural conscious sedation, also called procedural sedation and analgesia. It is used in combination with local, spinal, or nerve blocks to enhance a patient's comfort, and this can be administered IV as well as locally. What is malignant hyperthermia? Signs and symptoms? What needs to happen if this situation occurs during surgery? We can find this information on page 80. Malignant hyperthermia is an inherited disorder. In patients with malignant hyperthermia, muscle metabolism and heat production will increase rapidly and uncontrollably in response to the stress of surgery and some anesthetic agents. Fever, tachycardia, cyanosis, tachypnea, muscle rigidity, diaphoresis, hypotension, and irregular heart rate can develop. If this is not treated quickly, cardiac arrest can occur. The circulating nurse monitors the patient's temperature along with the anesthesia care provider. If the temperature begins to rise rapidly, anesthesia must be discontinued, and the surgical team needs to take measures to correct the physiologic problem. Know the 3 stages of general anesthesia. The 3 stages of general anesthesia can be found on page 78. The first stage is induction. This is when unconsciousness is induced. The second stage is maintenance. This is the period during which the surgical procedure is performed. The third stage is emergence. This is when surgery is completed and the patient is prepared to return to consciousness. Neuromuscular blocking agents are reversed. After a patient reaches what age will their rate of surgical complications increase by 3 times that of their younger selves? Why? We need to identify these patients before surgery to prepare appropriately for their risk. We can find some more information on this on page 66 within the red box, Older Adult Care Points. Patients older than 75 years have a surgical complication rate that is 3 times higher than those of younger adults. An older adult patient is less able to adjust and compensate for the stress of surgery due to their physiologic reserves declining with age. Older adult patients are more likely to have impaired renal, hepatic, respiratory, and cardiac functions that can alter their metabolism as well as their excretion of drugs and anesthesia. The presence of chronic diseases will cause vulnerability to fluid and electrolyte imbalances during and after a surgery. It's important to also measure height and weight before surgery so that the anesthesiologist can accurately measure and calculate anesthetic dosages. That's on page 66. Chapter 5, Care of Postoperative Surgical Patients. What scoring system is used to determine readiness for transfer from the PACU? What score would indicate to the nurse that the patient is ready for transfer? We can find that on page 84. A form of the Aldrete scoring system or other system is used to determine readiness for transfer. Activity, respiration, circulation, consciousness, skin color, and oxygen saturation are each given a score. A patient with a score of 9 or 10 is ready for transfer to the nursing unit. The patient arrives in the PACU and a short while later wakes up very confused. What should the nurse do? We can also find this on page 84. The patient may wake up confused and may need reorientation and reassurance that the surgery is over, that they are in the recovery room, and that their family member or contact person has been notified. Is atelectasis normal after anesthesia? Until when? Yes, we can see that on page 86, that some degree of atelectasis does exist after anesthesia. A mild hypoxia is usually present for about 48 hours after surgery. If any area of the lung remains atelectic for more than 72 hours, hypostatic pneumonia from retained secretions is likely to occur. What is huff coughing? What does this work to prevent? We can see this on page 87. If the patient cannot cough effectively, instruct the patient to huff cough. If the patient is too weak to remove secretions, tracheal suctioning can be indicated. Huff coughing can prevent atelectasis and should be performed every 2 hours. Why are older adult patients at a higher risk of respiratory complications after surgery? We can see this also on page 87 in the red older adult care points box. The risk of hypoventilation is greater in older adults because lung expansion may be hampered by calcification of costal cartilage and weakened respiratory muscles. End-tidal CO2 monitoring is effective in identifying hypoventilation in at-risk patients. After surgery on an extremity, what assessments should the nurse prioritize to assess circulation and tissue perfusion? We can also see that on page 87. If surgery involves an extremity, or if a procedure has been performed on any major blood vessel, such as the aorta or femoral artery, the distal or peripheral pulse is checked during each full assessment. The skin distal to the surgical site should be warm to the touch, and there should be brisk capillary refill in the fingers or toes. Blood pressure and pulse should be compared with preoperative values to determine whether there's any significant changes. An increase in pulse can indicate internal bleeding is occurring, but it can also signify incomplete pain control. BP that falls below the patient's normal baseline level can indicate major bleeding. Why do we assess vital signs in the PACU and what needs to be assessed? So I just read that one as well. That's also on page 87, and that would be your blood pressure and pulse, and it's important to compare them to your original baseline. Why is urine output monitored closely after surgery? What information would require the nurse to notify the surgeon? We can see this on page 88. Urine output is closely monitored after surgery. A patient without a catheter in place must void within 4 to 8 hours, depending on the type of surgery and the anesthesia used. If the patient is unable to empty their bladder spontaneously, obtain a bladder scan and, if needed, an order for catheterization. If the flow is less than 60 mL over a 2-hour period, the surgeon needs to be notified. The nurse is caring for a postoperative patient with a lot of painful flatulence. What are some helpful interventions to promote GI motility in this patient? We can see this on page 89. Discomfort from abdominal distension and considerable flatulence can occur after general anesthesia due to decreased or absent peristalsis. Taking only small amounts of liquid or food at a time, drinking only tepid liquids, and refraining from drinking with a straw can help keep flatulence to a minimum. Ambulating will also help move and evacuate the gas. The postoperative patient complains of pain, but they were just medicated with their PRN pain med 1 hour ago. What are some non-pharmacological interventions the nurse could try? We can see this on page 90. If it is too soon to give more analgesia, reposition the patient. Be sure that their bladder is not distended and causing discomfort. Check that the patient is warm enough and use other comfort measures, such as distraction and imagery, to relieve their pain. Note when the analgesia is due again and have it ready to administer at that appointed time. The nurse is preparing to ambulate the post-surgical patient for the first time. What steps should the nurse take to prioritize patient safety during this activity? We can see this also on page 90. Orders for ambulation may begin within several hours after surgery. Raise the head of the bed first and let the body adjust to the position change. Then sit the patient on the side of the bed, allowing their legs to dangle over the side with their feet on the floor or on a footstool. After a few minutes, slowly assist your patient to stand. Assist the patient to walk around the room for at least a few steps. Chapter 6. Infection prevention and control. Covering your mouth/nose while coughing or sneezing can help prevent the spread of bacteria via which route? That is going to be the droplet route. We can see this on page 112 within table 6.6, isolation precautions. Take a look at the droplet precautions. It's important to observe cough etiquette. This includes covering your mouth and nose whenever coughing or sneezing. Why is it so important to finish the entire prescribed course of antibiotics? This is an education point that needs to be stressed to the patient at discharge. We can see this on page 122 within table 6.9, some general nursing implications for the administration of antimicrobial drugs. Take a look at patient teaching. It's important to tell patients to take all of an antimicrobial drug prescription, regardless of whether they feel better or have no obvious signs or symptoms of the infection. The purpose of this is to prevent the development of multi-drug resistant microorganisms. How do antivirals work? We can see this on page 121. Antiviral agents interfere with the DNA or RNA synthesis required for the virus to duplicate itself. The most common side effects are headache, nausea, vomiting, anorexia, and diarrhea. More severe side effects include acute renal failure, encephalopathy, and bleeding disorders. Why are fungal infections so hard to get rid of? We can see this on page 105. Fungal infections in humans are called mycoses, and they're classified into three main types: cutaneous mycoses, which grow in the outer layer of the skin; subcutaneous mycoses, which involve the deeper layers of the skin, subcutaneous tissues, and sometimes bone; or systemic and deep mycoses. These involve internal organs. Fungal infections are difficult to eradicate once they have invaded a host, because fungi will tend to form spores. These are resistant to ordinary antimicrobial agents. Proton pump inhibitors, such as Prilosec, can decrease the amount of lysozyme in the stomach lining. Why is this important? We can also find this on page 105. Secretions from the mucous membranes lining the respiratory, gastrointestinal, and reproductive tracts contain an abundance of a bactericidal enzyme called lysozyme. This same enzyme is found in tears and saliva. Stomach acid and digestive enzymes will kill off most swallowed microorganisms. Prilosec can actually reduce the amount of lysozyme in the stomach. The nurse must medicate a fever after it surpasses blank degrees. We can see this on page 106. A fever up to 102 degrees Fahrenheit in adults is usually not treated unless a patient is uncomfortable. Why does excessive stress or fatigue put a patient at a higher risk of infection? We can see this on page 116 in table 6.7, risk factors for increased susceptibility to infection. Excessive stress or fatigue. These states will seem to interfere with the body's normal defense mechanisms. Define phagocytosis. We can see this on page 107. The process of phagocytosis is a form of innate immunity. This is the body's first line of defense at the cellular level. Within the first few hours of the onset of the inflammatory process, the monocytes will swell up. becoming macrophages, and then migrate to the site of inflammation. Neutrophils, which are a type of leukocyte, are also released and can kill both aerobic and anaerobic organisms. Describe the purpose of swelling and inflammation. We can see this on page 109. Swelling is the result of the increased permeability of the capillaries and the leakage of fluid from the blood into the tissue spaces around the cells. Blockage of the lymphatic drainage from the site will also contribute to local swelling. What is the best way to prevent infection? We can see this on page 110, and it should come as no surprise that hand hygiene is the primary intervention that any healthcare provider can use to control the spread of infection. Protozoa are microorganisms typically found in water and soil. To cause disease, some protozoans need to be ingested, whereas others are introduced into the body through the bite of a vector or a carrier like a mosquito. This is why it's important not to drink the tap water in Mexico. It's also important to note that a red, moist rash under inguinal folds and breast is a fungal infection. We can see more information about respiratory hygiene and cough etiquette on page 114. Two methods of preventing droplets from spreading to others are teaching people to cover their mouth when sneezing or coughing and turning their head away to prevent coughing into someone else's face. And that concludes this review.